Welcome back. So today we're starting a new segment that we hope you guys watching Fox 28 Morning Live love. It's called Ask a Nurse Practitioner, and this week is actually National Nurse Practitioner Week. And joining me is Dr. Stephanie Gray. Good morning, Dr. Gray. Thanks for being with us. And to start off with what is a nurse practitioner? We hear a lot about nurses, we hear doctors, but what is a nurse practitioner?
Well, nurse practitioners are quickly becoming the choice health partner for millions of Americans, and we are clinicians with additional expertise in assessing, diagnosing, and treating a variety of health conditions. Through our schooling, we also had additional emphasis on disease prevention and health promotion. And so we believe with this education, we can provide patients very comprehensive care that hopefully can translate into reduced patient costs. So for instance, patients who see a nurse practitioner as their primary care provider typically have fewer emergency room visits, shorter hospitalization stays, and reduced medication costs.
So what's the difference between a nurse practitioner and just a nurse?
Yeah, so we hate saying just a nurse because
nurses. I just mean the one word against the two. How's
because
that?
nurses are so important.
It's so true.
And we do have similar backgrounds. We're both nurses. So we should both be practicing holistically. Through nursing school, we're taught to practice from the bio, psycho, social, cultural, spiritual perspective. So we're very similar in that we can both practice in acute and in chronic settings. So for patients with acute or chronic diseases, meaning in a clinic or hospital setting.
Okay, and so with that holistic approach, kind of what do you mean by the whole spiritual and emotional and all that side of it?
Yeah, so there is an art and a science to nursing, and that's what we learn about much through our schooling. But and we believe treating holistically really encompasses even when we walk in the room to see a patient. You know, assessing the aesthetics of the room, what's going on, what are their spiritual beliefs. It's not just treating the biologic aspect of the patient, not just the labs, but also what else is going on in their lives.
I bet you didn't know that. I didn't know that. That's pretty cool. That's a lot. That's a lot to go in to treat someone like that. Where would maybe someone see a nurse practitioner?
Yeah, so you can see nurse practitioners almost everywhere. Now there are several different specialty avenues for nurse practitioners. So for instance, I'm an adult and geriatric nurse practitioner, but you may have seen an acute care nurse practitioner in an emergency room, pediatric nurse practitioners, family nurse practitioners, women's health nurse practitioners. There are even psych mental health nurse practitioners as well as nurse anesthetists. So again, you can see us in clinical or hospital settings.
And are all nurse practitioners doctors like you?
Yeah, so good question. So no, the major differences between nurses and nurse practitioners are our education and then our responsibilities. So the nursing profession can be a little confusing. There are different avenues to entering nursing practice. So there are LPNs, which are licensed practical nurses, RNs, which are registered nurses, and advanced registered nurse practitioners. So the difference is with entering nursing practice, you have to have an associate's degree, although several nurses now have a bachelor degree. To be a nurse practitioner, you have to have a minimum educational requirement of a master's degree, although several nurse practitioners now have doctorate degrees, which becomes a little confusing for the public. So I'm a nurse practitioner, but I have doctoral education. So some have doctorate degrees and some do not.
Okay, very cool. I didn't know that. They're so complicated. We're going to have a final check-in with Dr. Gray and also Justin's weather. We got another question for that you may be interested in. We'll be right back. We have a traffic alert right now. It's a live look at Interstate 380 near Swisher. There's a traffic slowdown. There was a crash southbound toward North Liberty. You can barely see that semi down the corner. That's about all you can see. The fog is so bad, you can't even see the backup. So just be aware if you're going that area, you should probably avoid it. Find alternate ways. You're going to be going slow, very low visibility, so be careful. And we have Dr. Gray back. We do have a question for that we think you guys are going to want to know the answer to. What are some ways, Dr. Gray, that we can keep our skin healthy through the winter?
So obviously stay hydrated, that's very important.
Drink lots of water.
Yes, but then take a high quality fish oil.
Okay.
So fish oil is great for really lubricating the skin, even the gut. It's great for constipation. It has other benefits, great for cardiovascular disease and lowering cholesterol. But because fish oil is so oily, it can really help with dry skin. So I do recommend patients purchase a high quality fish oil that's not laced with mercury or other additives. Usually through a licensed clinician office is where you can find the high quality stuff.
All right, awesome. Thank you, Dr. Gray. And Dr. Gray will join us over and over. She'll be recurring with questions that you want to ask her and you need answers to.